Welcome to the Apollo 360 Health Podcast. I'm Dr. Michael Ghalchi, a board-certified cardiologist and the founder of Apollo 360 Health. And I'm here today with my good friend, Jay Cardiello, who is a fitness expert and our health coach here at Apollo 360 Health. Good afternoon, Jay.
Michael, thank you so much for having me. It's an honor to be here today.
And today we're going to be talking about sleep and the importance of sleep, not just for our cardiovascular health, but our mental health, our general health, and how important sleep is.
It's quite interesting, Michael, about sleep because it's so much of our society is built upon a badge of honor. I don't sleep, so I wake up at 5 and I get 3 hours of sleep or 4 hours of sleep. Sleep is, in my opinion, one of the most imperative parts of health and wellness. And it's so important, and people overlook the importance of sleep. It affects your anxiety, it affects your performance, your cognitive level. There's so many things that it affects when you don't implement it. And I know that we've been working together here at Apollo to help people get a more effective sleep. And I was just thinking, things like box breathing and other things. What are some of your ideas on how people can get better sleep?
Sure. I'm glad you brought up that idea of sleep and anxiety and health and
Mm-hmm.
how very often this leads to this vicious cycle. And
Yes.
so in my experience, I have plenty of patients who get stuck because they have high stress, poor sleep, that results in things like high blood pressure or their blood work being abnormal, inflammation levels being high, blood sugars being elevated, and then that ultimately results in poor sleep, which then perpetuates this cycle. And so one of the things that we often try to do is break this cycle.
Yes.
And we found this to be very fruitful. People end up being able to go off of their blood pressure medicines, their diabetes improves, they feel great, and it's all by really understanding what the root cause of all of this was, addressing that root cause, whether it's sleep being the initial driver
Mm-hmm.
or poor sleep being a consequence of something else like poor stress management, etc. One way or another, by getting into the root cause and helping people sleep, we're able to really improve their lives.
Yeah, you bring up a very valid point. The root cause is so many people overlook it. People don't think about sleep enough. We think about, oh, what our diet is like, what our exercise, what's our nutrition's like, but we don't recognize the importance of sleep, and we overlook it a lot. One of the biggest things that I always tell people, a way that we can decrease anxiety and stress, is through what we call box breathing. And you think about box breathing, you think like, oh, am I inside of a box? Am I breathing or anything like that? No, it's a pretty simple way that you can decrease your stress level and anxiety levels. You just simply take a breath 4 count in through your nose, then you hold it for a 4 count, then you exhale for 4, and then you hold it again. And you repeat that for anywhere from 2 to 4 minutes. And that helps decrease your anxiety and stress levels. And it's a great way. You can do the first thing in the morning, you can do it throughout the day. Maybe you want to take a nap, or you can even do it first thing right before you go to bed to help you get in that mood to start sleeping better and more effectively.
That's such a great simple exercise that could really go a long way.
Yeah, it really can, and it's made a difference in my life. It's made a difference in the people we talk about, or with people we talk to each and every day. But it's a simple and effective way that you can really go after the root cause of that stress and anxiety, as opposed to just popping a pill. You can work on your sleep and maintain your stress levels that way.
That's really great advice, Jay. And I'm glad you brought up this idea of things being connected.
Yes.
Our health, things don't happen in a vacuum. And so our stress is related to our sleep. Our sleep is related to our blood pressure. A lot of the cardiovascular things that we often worry about, high cholesterol, inflammation, high blood pressure, developing plaque or atherosclerosis that leads to heart attacks, strokes. All of this is part of the same story.
Mm-hmm.
And one of the things that we really pride ourselves here at Apollo 360 Health is to not just put a band-aid on things, but to really dig deep and see for each person what are the small things they can do
Yes.
that helps really improve all of this down the line. And I think the example you just gave of a simple breathing exercise, that might go a really long way for people, even more than maybe a medicine in some circumstances. Not to say that there isn't a role for medicines, of course there is, but at the same time, I think there's oftentimes these little nuggets
Yes.
that we can dig and find and help people with, and then as a result, that kind of dominoes in their health, in their mental well-being, really throughout their lives.
Yeah, and to keep it simple, that's one thing I wanted to bring up today is about being simple because when we think about putting too much on our plate, then we get stressed, then we get anxious, and we're like, oh no, another thing. But box breathing is something simple, and you have to breathe in order to stay alive. So you might as well just go and say, hey, listen, I'm going to breathe for an in count of 4. I'm going to hold for 4. I'm going to exhale for 4, and then I'm going to hold it again, and that's going to decrease my stress and anxiety levels. And it's something so simple. And you're right, everything is so interconnected. We think about sleep, we think about, oh, it's compartmentalized, it's not part of my body, it's not part of my nutrition. It's all connected. And we see it. If you don't get enough sleep, your nutrition goes through the roof. You start reaching for those comfort foods, you start reaching for the sodas and the snacks and everything. So we really have to gain strength in our sleep. And it's so interesting that athletes know this. They sleep anywhere from, 7, 8, 9, even more hours than that, just in essence to get their body to a resting position. And we don't do that in society. We think, as I said before, it's a badge of honor if I don't sleep. It's not a badge of honor. You should really put forth the effort to get you most sleep as much as possible to decrease in stress, anxiety, but also to put your body in a good, healthy position.
I always say to people that after a good night's sleep, the world is a different place.
It is a different place. It's such a different place.
And so that's a good segue, Jay, into us talking about. So you mentioned about quantity of sleep,
Mm-hmm.
but also I want to talk a little bit about quality of sleep.
Yes.
And so there are some medical conditions that people have heard a lot about, things like obstructive sleep apnea, and we're learning more and more how our sleep, beyond just quantity, but really the quality of sleep also matters. And sleep apnea is something that people know about, that if you have sleep apnea throughout the night, even if you're getting a good quantity of sleep, because the quality is poor, you're
Mm.
waking up throughout the night repeatedly without knowing it. Your oxygen levels are going down, your blood pressure is going up, your inflammation levels go up. There's a lot of consequences to that poor quality sleep. We're also learning that even people that don't have sleep apnea, if their quality of sleep is not great, that actually matters quite a bit
Yes,
too.
it
And,
does.
and that can be even things like, having to wake up many times in the middle of the night to go to the bathroom. That's one of the things that we often address with some of our older patients, and in particular older men, also older women. In older men, it often is a sign of an enlarged prostate. And so one of the things that I do is that I encourage my older male patients that have this condition to speak with their urologists to
Yes.
see, is there something they can do to help their prostate so they're not waking up repeatedly throughout the night. And my patients that have done that and have addressed that, lo and behold, their blood pressure is better.
Wow, that's amazing. That is amazing. Are you seeing a lot of people with sleep apnea these days coming in?
We see sleep apnea is very, very common. It's obviously linked to weight,
Mm-hmm.
and so there is this idea that as our population gains weight, there's more and more sleep apnea. But we're also starting to see that even in people who are not overweight, there can be sleep apnea. Usually due to kind of the way our faces are really developed, and the way kind of our anatomy is, can sometimes lead to sleep apnea, even in people who are not significantly overweight. I think it's such an underdiagnosed and undertreated condition,
Mm.
and I think there's a big opportunity there for understanding who has sleep apnea and then treating them. One of the things that I found is that patients are hesitant sometimes to even consider if they have sleep apnea because they've seen the treatment, which is
Yes.
CPAP.
Yeah.
CPAP is the first line treatment. It's the gold standard. Many people don't even want to consider using CPAP. And so our approach here is not cookie cutter. It's not, if you have sleep apnea, you have to start CPAP. It's let's take a look at the details. Sometimes we'll find after doing a sleep study that someone has terrible sleep apnea when they sleep on their left side but not on their right side. And so for those people, we encourage them to get a pillow that forces them to sleep on their right side. There are other types of therapies available, oral appliances, etc. So I think by really kind of having an approach where we first gather information, is there sleep apnea or not? Let's learn about some of the details, and then really figuring out the right treatment for each person, and that might look very different. And so when and in my experience, when I speak with people about this before doing the sleep study, then they are much more open-minded. They are really kind of inspired to see if this is part of the reason why their blood pressure is high, or they can't get a hold of their nutrition the way they want to, or their blood work looks a certain way.
Mhm.
And by addressing that, again, going back to that idea of addressing the root cause, then we're able to help those medical conditions, downstream.
One thing I love about Apollo is that we look under the hood. It's not cookie cutter. It's not just, oh, you have, you're sleep deprived. Here's a CPAP machine. It's like what it actually is going on. And there's so many underlying conditions, with lack of sleep. There could be a host of things, and people think, I got to wear a CPAP machine, and it's just like, no, there could be so many things. And that's one thing that you do so well here at Apollo, is that you go beyond just with sleep, especially when we see so many people being so sleep deprived. They're just like, what do I do, Dr. Michael? And you're like, here's what you have to do. And that's one thing that's great about it. One thing I also like to point out is that it's interesting, talking to the clients and the happiness that they're seeing when they start working on their sleep. As you said before, it's just like you live a different life when you do get sleep. And it's so important. There's quality of sleep, the quantity of sleep, but then also the feeling that you get after a good night's sleep. I mean, you're not reaching for, as I said before, the chips and the hostess. You're not in a bad mood. You're waking up with a lot of vibrant and feeling good about yourself. So sleep is so important, and it's such a great thing that we really have to go forth and put a great deal of effort into, as opposed to just saying, hey, I got to go to a CPAP machine, and that's one thing. So kudos to you for what you guys are doing here at Apollo and everything.
Thanks, Jay. I'm so glad you're a part of
Oh,
it.
I know. This is an honor to be here.
And yeah, our approach in regards to that is that we help our patients invest in their health. It'd
Hmm.
be very easy to go to the doctor and just get a prescription for a blood pressure medicine, or get a
Yes.
prescription for a diabetes medicine, come back in 3 months, come back in 6 months or a year. But I think by investing a little bit up front, digging a little bit deeper up front, you can find a solution that really helps people go down an entirely different path, and that's a real source of pride for me and for the company.
Yeah, it is. It's really, especially when you guys are looking at something so intricate, as the human body is. And, there's so many things that go on in it. And people are just, they go to the doctor, they get their 8 minutes. At Apollo, we go beyond those 8 minutes. And that's one thing is so great, because it's something like sleep, which we are so deprived in as a society, that there's so many underlying conditions beyond it. And that if you just take sleep for what it is and say, oh, you just need this machine, you're not going to, we at Apollo go beyond that. And we're not just going after the cookie cutter approach. So, going forth in this, it's just so, I guess it's so happy when I see your patients so happy when I'm talking with them and saying, I'm sleeping better, I'm feeling better, I'm eating better. And it's all because you're investing in more than just what the client is or what the patient is telling you. You're going far beyond that.
Absolutely. And
Yes.
actually, that's a nice there's a nice connection between that and the way we approach data gathering.
Mm,
And so I know today's topic is sleep, but like you said, each person is different. And for
yes.
one person it's sleep, and for another person it's something else. And the way we get to that answer is by doing a thoughtful evaluation, gathering data. That data can come from a lot of different sources. It comes from the person talking to us. It comes from understanding them medically through blood work, or through, in this example, a sleep study. It also kind of the I think the future in this regard is wearable technology. There's so much information that we all generate through the devices that we use. Smart watches, scales, blood pressure monitors, our phones, even, you name it. And we're really excited about bringing in that information, knowing how to interpret it, how to look at it within the context of who this person is as an individual, and use that information to, one, identify what is the root cause of whatever our patient needs,
Mm-hmm.
and also then help use that data in terms of its management on an ongoing basis.
Yeah, and it's interesting that you use. I will have all my wearables on and everything like that. It's interesting that it's not just the person's name; you go beyond it, and that's one thing a wearable can help you gather is that sort of data, which is very imperative to get a better understanding not only of who they are, but what actually is going on within their body, and also what's going on in their minds. Because as we know, your mind races and it keeps you up all night, and you can't get any sleep. So it really does help wearing these wearables and getting the best information that you can to make the best diagnosis on a person. One thing I wanted to ask you is, do you think we'll ever go into AI, anything for wearables?
Oh, so I think we're just scratching the
Just scratching the
surface
surface, yeah.
of what can be done.
Mm-hmm.
And one of the things that we're starting to do is to really use artificial intelligence in the context of clinical
Oh,
intelligence,
wow.
and use that in a way that really helps identify the root cause
Mm-hmm.
of problems, and helps in its management. And AI comes up so much these days.
Does.
Um, I think one of the things that we emphasize here at Apollo is that we don't think AI is a solution. We think AI is a tool, and we've worked really hard to figure out how to use AI as a tool to help our patients. And especially when you're talking about kind of data and data science, that's something that I find very exciting. And we're just scratching the surface.
That's amazing. Is it what are you planning for in 2025 and beyond? Anything exciting coming up with AI?
Oh, absolutely. So I think one of the things, again, that is a little bit unique about us is
Mm-hmm.
that we're able to get data from all of these different data sources. And so for a given patient, we know a lot of things about what's happening medically. We know a lot of things that's happening blood work wise, based on their wearable data. And so we're developing our own models on how to use this data to really help each person along their journey towards better health. But we're doing this in a way that the AI isn't, front and center. The AI is a tool that we use clinically. The AI is in our pocket. The AI is in our, is in our, is in is, we use the AI as opposed to the other way around.
AI using us.
And so,
Yeah.
actually, one of the things that we're really excited about, it has nothing to do with sleep, but we
Yeah.
mentioned blood work, and you were talking about AI. One of the things that we're now doing, in it's not quite ready for prime time yet. It's
Mm-hmm.
not in production within our software yet, but it's in our staging environment and working really nicely. Is that with a touch of a button, we can see someone's blood work from as long back as we can possibly go. And so now we can say, hey, I know that this person has diabetes, let's say, and I can trend their blood sugars from 20 years ago. I can see how it's going up and down, and then we incorporate data like sleep data. And so now we can see, like, okay, how does your sleep affect your blood sugar? How does your inflammation level change when your sleep changes? These kinds of insights, and like I said, we're just scratching the surface. We're
Yeah.
just laying the foundation for how we'll be able to make good use of this information, in a way that I think has never been available before. So, Jay, we've covered so many interesting things today. We've talked about wearable technology, sleep, how sleep can be connected to all these stubborn medical conditions, how it can affect your choices, your mental health, all of these other things. You gave everyone this fantastic exercise that they can
Yeah,
try at home.
box breathing. It's great. It's very simple, very easy to do. It's simple. You take a 4 count inhale through your nose, hold it for a 4 count, exhale for a 4 count, and then hold that breath for a 4 count. Decreases stress, decreases anxiety. You should do it anywhere from 2 to 4 minutes any time of day. But if you're having trouble sleeping, I recommend doing it right before you go to sleep.
That's great advice, Jay. And if I can give people a little takeaway along those lines,
Mm-hmm.
is to look at your sleep. Think about your sleep. Think about how it might be connected to some of these other things. It might not be immediately obvious, but by really kind of looking at sleep from a different perspective,
Mm-hmm.
I think our listeners and our patients might start to realize that, hey, my sleep is connected to this, or I'm not able to do this now that I think about it. It might be because of my sleep, and the exercise you gave is such a fantastic tiny little thing that someone can try
Mm-hmm.
and then see how that affects all these other things. Try it for a week, try it here and there, and see how that plays out. See how that affects your blood pressure. See how that affects your mood. See how maybe your partner says that you were tossing and turning less that night. So we really believe very much in learning about what might be going on with your health, and trying things based on good advice, based on solid advice, and then seeing how it works.
Yeah, it's been a great idea, especially with the box breathing. Something so simple can make such a big difference in your life.
Jay, thank you so much for joining us today here at the Apollo 360 Health Podcast.
Oh, it's an
We
honor.
it was such a great time speaking with you, and we're very excited for this series, which we think can really help people in a practical way. And this afternoon, this is the first of many podcasts that I think you and I will be teaming up to do, to talk about some of these common things that people struggle with, and how we might address those things in simple ways, in practical ways, in ways that make sense for people, making use of technology, making use of information, but really bringing it back home, and making it useful and practical and pragmatic and impactful. And so I want to thank you again for being here today, Jay.
Oh, thank you so much, Dr. Michael. It's an honor.